The U.S. healthcare system is covered by cash-sucking parasites concerned only with money and not patient health. Most Americans are aware of the insurance companies ripping off the public. Few people are aware of the pharmacy benefit managers. Pharmacy benefit managers, PBMs, are members of the healthcare robbery team that manipulates the prescription drug market on behalf of health insurers. PBMs have a significant behind-the-scenes impact in determining total drug costs for insurers, shaping patient access to medications, and determining how much money pharmacies make. 3 PBMs control 80% of the market: CVS Caremark, Express Scripts, and Optum Rx. Combined, the big 3 PBMs serve around 270 million Americans. The concentration of these companies allows them to have substantial control over drug pricing. The methodologies PBMs use to determine which drugs patients can access and how much patients will pay for drugs are unknown. It's not just your doctor in charge of your treatment. Like the health insurance companies, the PBMs play a role in patient therapy. These healthcare parasites justify their existence by claiming they negotiate drug prices on behalf of their clients. This justification is a Scooby-Doo mask that hides who they really are. PBMs are far more influential because they fully administer prescription drugs through something called formularies. They make coverage decisions and determine if a treatment is medically necessary. Determining if a treatment is medically necessary is also the job insurance companies claim to do. For insurers and PBMs, deciding medical necessity seems to be code for determining the most profitable action. There are 2 central practices PBMs use to maximize their revenues, which can drive up the price of prescription drugs. The first practice is to seize a percent of the rebate paid by the manufacturer to the insurer. Rebates are rewards to the insurer for drugs sold under the list price. What is the list price? The list price is the initial price before discounts, rebates, or negotiations with insurers or pharmacies. The higher the price of a covered drug, the steeper the potential discount, some of which the PBMs may keep as a profit. PBMs pull this scheme off by steering patients to higher priced drugs with higher rebates by utilizing formularies of selected drugs they create and update. What is a formulary? A formulary is the list of generic and brand name prescription drugs covered by your health insurance. Drugs are carefully placed in favorable formulary positions to encourage people to opt for these drugs. Each tier has different prices and copays, controlling the amount people pay out of pocket. Drugs not on the list are typically only expensive brand name medications obtained if the patient covers the cost. As patients purchase the more expensive drugs on the formulary, the PBMs can retain a more generous portion of the rebate for every claim. The rebate is a problem because it encourages drug prices to be higher than without rebates. The solution is to apply the manufacturer rebates and pharmacy price concessions to the drug price at the point of sale. There is no incentives for PBMs and manufacturers to lower drug prices. The second practice is called spread pricing. Spread pricing is whenever PBMs receive a higher payment from insurers for a drug than the price they had to pay the pharmacy. Insurers contract with PBMs to receive discounts and lower prices rather than just accepting the list price set by the drug company. The prices insurers are supposed to pay pharmacies are not the same as the reimbursement amounts they receive from PBMs. Legislators, manufacturers, researchers, and others have recently scrutinized spread pricing as a driver of high drug costs. When PBMs engage in spread pricing, they take the savings between insurance companies and pharmacies as profits and pass on the difference to patients as higher premiums and copays. Spread pricing allows PBMs to make 4 times more in gross margins for generic drugs than they would with brand name drugs. Accordingly, some experts report that PBMs overcharge for generics. The Wall Street Journal estimated that Cigna and CVS Health, both of which own PBM services, can charge prices for specialty generic drugs that are 24 times higher than what the manufacturers charge. As a solution, PBMs should provide the public with a transparent drug pricing model, disclosing rebates, pricing data, and fees along the supply chain. Pharmaceutical companies frequently set high prices on brand name drugs and abuse the patent system to maintain high prices and exclusivity while preventing generics and biosimilars from coming to the market. When generics or biosimilars reach the market, competition should lower prices for a given drug. As in the case of the drug Humira, some PBMs list biosimilars on their formularies at the same price as their brand name equivalent, providing little incentive for patients or providers to switch medications. Manufacturers also leverage their market power to use this arrangement to their advantage. For example, AbbVie, the manufacturer of Humira, reportedly threatened to take away rebates for 2 other high-priced brand name drugs if plans recommended biosimilars over Humira. These tactics work. In 2023, Humira maintained 98% of the market despite the entry of 5 biosimilars. PBMs are a stand between the manufacturer, insurer, and the pharmacy. They play a critical role in determining access to drugs and drug costs. Evidence suggests that PBMs profit by artificially inflating drug prices, capturing portions of the discount they negotiate for insurers, and pocketing the difference between what insurers pay and what the pharmacies receive. PBMs are not the only contributors to high and rising drug prices, and their reform alone is not enough to make prescription drugs affordable and accessible for patients who need them. The U.S. healthcare system is a patchwork of agencies working together to profit as much as possible under the guise of healthcare service. Manufacturers, insurers, retail pharmacies, wholesalers, and PBMs seize profits in the drug price supply chain. The key to lowering drug prices will involve taking away the profit motive in the healthcare system. The healthcare system cannot serve 2 masters. Either the healthcare system serves the patient or the capitalist. Capitalism and healthcare cannot balance, since greater profits are always prioritized. The only solution is creating government-controlled healthcare that regulates and restrains prescription drug prices.